I think this might be okay. Okay.
Before going into the patient's room, I have gone into their chart. I have familiarized myself with important information that I might need. I feel ready to go in and do my assessment. Okay, so I'm at the door. I'm looking for any signs or precautions. I don't see any. I'm just going to assume and practice standard precaution. Alright, privacy has been given. Hi, my name is Pam, and I'm going to be your nurse today. How are you feeling today? Good. Charting and hygiene. Perfect. Okay. So I am here to do a head-to-toe assessment on you. Is that okay?
Yes.
Awesome. Before we begin, I want to confirm your full name, date of birth, and age.
Yes, Brianna Fader, 33193.
Wonderful. Matches your wristband. Awesome. I'm going to lift up your bed a bit. Awesome. Okay. So, let's see. Do you know where you are today?
Yes, Bellevue College Hospital.
Perfect. And then, do you know what month it is?
October.
Overall pain
And then,
or shortness of breath
what brings
right
you in
now?
today?
I'm just here for a general check.
I'm going to start
General
with
checkup. Awesome. Go ahead and do that for you. Just by looking at you, you're conscious, you're responding to me, you're alert and oriented, looking at your face, face looks good, symmetrical, even in color. I'm seeing your bronzer, lesions on your face or head, scalp looks good, no bald spots or anything, no signs of lice. Wonderful. Okay. And then, you go by Grace?
Yes.
That's how you want me to address you?
Yes.
Do you have any preferred pronouns?
She, her.
She, her? Okay. Are there any cultural or spiritual beliefs that you want me to know?
I don't have it.
Alright, wonderful. So I'm going to start off by asking you some general health questions before I begin the actual physical exam. Is that okay?
Yes.
So, to start off, are you feeling any pain?
No pain.
Okay. Any shortness of breath?
No.
Chest pain?
No.
Okay. Wonderful. If you had said yes, I would have you rate your pain on a scale of 0 to 10. Let's see. So, no chest pain. Are you breathing okay?
Yes.
Okay. Any history of pneumonia, COPD?
No.
Or any other? Okay, wonderful. And then any history of hypertension or heart attacks? No. Okay. In your family?
No.
No. Okay. And then any abdominal pain? Or just like abdominal pain? Are you going to the bathroom okay? Urinating?
Yes.
Yeah, no pain or odd color that isn't yellow or frequency?
But we could pretend like this. Yeah.
And then, are you experiencing any diarrhea or constipation?
No.
Bowels working okay, wonderful. And then, do you feel any nausea or vomiting?
No.
No? And then, do you feel any numbness or tingling in the body?
I do not.
No? Any joint pain?
No pain.
No pain? Okay. Any history of neurological problems?
No.
You and your family? No. Okay. Are you experiencing any anxiety or depression?
No.
And then, do you use any assistive devices?
I do not.
No. Do you wear any glasses?
I do wear glasses.
Glasses, okay. And then, how's your hearing?
Good.
Okay, and then let me see your body. Okay, nice and comfy, wonderful. Those are good questions for now. Oh, any oxygen? Do you use any oxygen?
I do not.
Okay, so your room area, no intensive spirometers or anything. Wonderful. Okay, Daniel, I think we are ready to begin the physical assessment. So, your hands are clean. Okay, I'm going to start off with the neural assessment. I'm going to be doing that to test your 12 cranial nerves. We have olfactory, optic, ocular, motor, and then we have the trochlear, and then the trigeminal, abducens, facial, and then we have the vestibular ocular, and then the glossal pharyngeal, and then the vagus, and then there's the accessory and hypoglossal nerves. So we're going to be testing those out. Okay. So to start off, I'm going to be testing cranial nerve 1, which has to do with smell. So I'm going to be using
your facial muscles, which are
if you could close your eyes for me. I'm going to be leaving some sand in your nose, and if you could tell me what it is you smell.
so the realness.
Wonderful. Okay. Next, I'm going to be testing those cranial nerves 2, 3, 4, and 6, which have to do with vision. I'm going to do that with your other eye. If you can look over my left shoulder, I'm going to shine the light in your eyes.
Able to follow instructions. She is alert.
Perfect. Your pupils and people around reactive to light.
Also, she doesn't have slurred speech.
Wonderful. Eyes are
I'm
not
not
fading. And
your
if you
eyes,
could keep looking at that pen light and
which
catch it with your
are
eyes. And your
cranial nerves
whiskers.
2, 3, 4,
Perfect. 6 cardinal points of vision look good. Next, the cranial nerves 5 and 7, which have to do with trigeminal and facial. If you could close your eyes for me, I'm going to touch your face with a cotton ball, and I want you to tell me or point to where it is that I'm holding you.
over my shoulder line.
Wonderful.
Her eyes were
Awesome.
equal,
That looks
round,
good. We're going to make some faces. Big old smile. Frown. How about your cheeks? Raise your eyebrows. Awesome. Perfect. Those look good. Next, I'm going to be doing the cranial nerves 7, 9, 10, and 12, which have to do with your mouth. If you can say after
her
me.
eyes are reactive.
Stick out your tongue.
I'm
Move
not
side to
going to be
side.
testing
Good.
her
You can give me a dry
which is
swallow.
the best.
Say right tight dynamite.
Right tight dynamite.
Perfect. Those are good. Next cranial nerve 8 has to do with your hearing. So if you could close your eyes, I'm gonna snap my fingers next to your ears, and I want you to tell me if you hear them on the left or right.
Over this way. Trachea is
Awesome. Looks good. Next, you can open your eyes. Cranial nerve 11 has to do with your spine. I'm gonna place my hands on your shoulder.
I'm going to check your
Perfect.
first.
And then, not sure if I asked, but throughout this assessment, I'm going to have to touch you. Is that okay? Let me know when you're comfortable. Wonderful. Neuro assessment looks good. Next, I'm going to be assessing your upper extremities. So I'm going to touch with the back of my hand.
Refill is less than 2.
Perfect, warm, dry, even hair distribution. Hand looks good, nails look good. Gonna check that capillary inflow. Wonderful. Looks good. Under 2 seconds, if you can flip your hands over. Gonna be feeling that radial
I'm
pulse.
also going to assess
2 plus, strong, moderate bilaterally, and brachial pulse. Also 2 plus, very normal and equal. Wonderful. If you can grip my fingers, strong grip, great. If you can put your hands like this and wiggle them, rotate your wrist, awesome, and then tap your fingers to your thumb. Good coordination, awesome. Okay, that looks good. I don't see any wounds, IV lines, lines, and then your neck. If you can look up, trachea looks midline. If you can look over to the left, nose over here, vein distension present. I'm gonna feel for your carotid, so if you can kind of look up central. Carotid pulse is also 2 plus, nice and strong and even. Looks good. Again, no central lines, no drains anywhere. Wonderful. Okay, so we did your head, your neck, your arms. Neuro. Next would be a cardiac assessment. So if you can remove your gown kind of to your waist. Awesome. Perfect. Okay. Wonderful. I'm going to place my hand on your chest and I need you to breathe in and out. Wonderful, very symmetrical movement, very symmetrical. And then I didn't feel for any crepitus. I'm going to be listening, or feeling and listening to your heart, cardiac landmarks. I'm going to take this. Listening with my diaphragm first, then with my bell. I'm going to start to the right at the midsternal border, the aortic valve, intercostal space 2, right here.
And upon examining her arms,
move on to the left side, intercostal space 2.
She also doesn't have a Foley catheter.
The
I'm gonna do
pulmonic
while have your legs exposed.
Sitting down that left side, intercostal space 3, Herb's point.
Okay.
Wonderful. Moving down intercostal space 4, following that left midsternal border tricuspid valve.
Sure. Okay, very good.
And then going along the midclavicular line on the left side is the mitral valve. If you could lift your breast tissue up slightly. Good.
Starting with the dorsal
Wonderful. Gonna flip over with my belt, go over the spaces.
Very strong pulses, even on both sides. Checking out the capillary refill in the toes. Less than 2 seconds. Also checking out the ankles. I don't see any breakdown. I'm gonna have her test her strength. Can you push down on my hands like gas pedals?
Awesome. I didn't hear any epiphyseal sounds, no heart murmurs, no S3, S4 sounds. Lug dub present in all of the cardiac landmarks, which is great.
I'm gonna check out her
The skin
gastric
looks good. No
laying down the
wounds, no
bed just
drains.
a little bit more flat.
Gonna
so
listen to your
excessive
lungs now, okay?
appropriately.
With that
Do
diaphragm.
you have any constipation?
Okay, I'm gonna start above the mid-clavicle, right about here, intercostal space 1, I believe, above clavicle. I'm gonna start on that left side. Take a deep breath in and out when you feel my stethoscope. Good. Other side, right side. Wonderful. I'm gonna ladder zigzag down, intercostal space 2 on that right side.
Vowel sounds.
Good. I'm gonna kind of go like this along the midclavicular line. Next, I'm gonna go to the left intercostal space 2.
I don't see any bloating or distension.
Down intercostal space 4 on the left side.
Right here in the middle. Once again.
Good. And then on the right side, intercostal space 4.
Okay, I'm gonna assess.
Good. Intercostal space 6 on that right side.
Do you have a history of lung
Left
disease?
side intercostal
Any
space 6.
trouble breathing? Shortness of
Good.
breath?
And then I'm gonna go along the anterior anterior axillary midline, intercostal space 6. Then I'm gonna go to the same spot on the right side.
Sorry.
Wonderful. Gonna go down intercostal space 8 again, following that axillary line. Wonderful. Other side, same spot. Your lungs sound good. I didn't hear any adventitious sounds, no crickles, no crackles. Again, I felt no crepitus. Everything looks good. Next, I'm going to be going to your gastrointestinal. I'm going to be looking. I don't see any distension, no wounds, nothing concerning. Skin looks even all throughout, in color and temperature. Okay, I'm going to be listening with my stethoscope and then feeling. Do you feel, are you experiencing any pain down there?
Okay, I'm gonna raise the bed down and have you sit here
Starting
on
with the
side.
right lower quadrant. Gargle, gargle. Gargle, gargle.
Go ahead and move on to the side.
Oh, very active
First, I'm
bowel
gonna
sounds.
assess your
Okay, now
posterior.
I'm gonna palpate using closed hands.
For one,
Wonderful.
go ahead and
Inhaling.
lean forward with your hands on your knees. First,
Doing
I'm
one
just
big press
feeling
right
to
in the
see there's
center.
any crepitus, which I don't see
Any
or
rebound
feel.
tenderness
I'm also
there?
examining her
No?
coccyx
Okay.
while she's
And
sitting up. I
then
don't see
I would
any
further
pressure
inspect
ulcer
bladder if
breakdown.
necessary. I would inspect the perineal area if necessary. Although by taking a glance, I see no Foley's. Again, no tube surgeries, no PICs, no IVs. Nice and good. Wonderful.
Starting at
Okay,
C7.
I'm gonna cover you back up for
6,
modesty.
down.
Wonderful. Gonna uncover lower extremities. Okay. I'm gonna feel with the back of my hand your legs. Even and warmth, no moisture, even hair distribution, no bruises, no edema that I saw on your arms or your legs. Looks good. Toenails look healthy on both your feet and the nails on your hands. Gonna test that capillary refill on your toes. Under 2 seconds, which is wonderful. I'm gonna put my hands on your feet, push down, now towards you. Wonderful. Can you lift your legs up? Awesome. Movement, coordination. Can you wiggle your toes? Roll your ankles. Wonderful. Gonna feel those feet pulses. You got the dorsal pedis.
Okay, do you need anything right now?
2+ bilaterally strong present. And then your posterior
I'm
tibias.
gonna do hand hygiene, and then
2+
I'm going to document.
bilaterally present, equal. Wonderful. Your feet look good. I'm gonna cover you back up.
Did you go like this on my back?
Okay. And then, okay, you've done that. Next would be to have you, I'll lower the bed, and I'll have you swing your legs over. I'm gonna listen to those
You
leg
could
sounds.
also just like comment if like that's the only thing. I think it is.
No joint pain, right?
No joint pain.
Like
Okay.
repetitive.
I'm
Yeah, I feel like it's
looking
getting
at your
worse and
back,
worse because like
your
it's actually
pockets here, your butt, no
Yeah,
pressure
it's like
sores, no
repeating.
bruising. Looks very even. I'm gonna put my hands
Yeah.
on it, take a deep breath in and out.
Yeah.
Breathing symmetrical bilaterally looks good. I don't feel any bumps or lumps or anything concerning. I'm gonna take a listen with my stethoscope. Using the diaphragm, starting at C7, gonna go 2 to 3 inches to the left. Take a deep breath in and out.
It's too much.
Good. Right side. Wonderful. That intercostal space 2 is where I listen. Then I'm gonna zigzag ladder down, intercostal space 4. Wonderful. Following that mid-clavicular line. Other side, left side, intercostal space 4. Good. Good thing. Down that same side, intercostal space 6. Good. Right side, intercostal space 6. Wonderful. Then I'm going to go to the posterior mid-axillary line, intercostal space 6. Other side, same spot. I'm going to go down to intercostal space 8, following that posterior mid-axillary line. Other side, same spot. Wonderful. Okay. Very healthy lung sounds. And again, I'm going to have you cross your arms and lean forward. I didn't tell you to do that, but you did that naturally. Thank you so much. Okay. And then I'm going to be doing something called the Romberg test on you next to check your balance. So if you can, I'm going to make sure you have your grippy arms on. You can stand, feet together, arms at your side. Nice and tall, close your eyes. Your balance is good, wonderful. And then I'm going to have you walk heel toe towards me. Good. And then turn around, walk back how you normally would. That looks good. Awesome. Your beat looks good. And then you can take a seat. Overall, skin very healthy. Your movement is good. And then sensation real quick, because why not? Close your eyes. Tell me if it's dull or sharp. Sharp. Wonderful. Okay, awesome. That pretty much completes the assessment. I'm going to perform my hand hygiene again. Do you have any questions or concerns for me?
I do not.
No? Okay. Are you comfortable in this position?
Yes.
Do you have to go potty?
I do not.
No? Okay. And then here are your glasses.
Thank
your
you.
phones. And yeah, this position comfortable. That completes my assessment. I'm going to make sure to go document that. And yeah, call if you need anything. Here's your call light.
Thank you.
All right. It was good seeing you.
Nice to see you.
Okay.